Well, yes, that's a very, very good question, and I'll answer that clearly. Whether you go for vasectomy reversal or retrieval of sperm with IVF is usually a personal decision, what you're most comfortable with. With vasectomy reversal, you get pregnant naturally, and it's not a medicalized situation with IVF. On the other hand, if your eggs are older and you're 38 years old, you may prefer to go right to IVF because you may need IVF anyway, and just having a good sperm count may not be enough. So I talk to each patient to individualize this. Now, in your situation where you have PCOS and you're either not ovulating or you're not ovulating or you're ovulating too late in the cycle, so the eggs are too old, with PCOS, you're going to need IVF anyway. So, since you're going to need IVF anyway for the PCOS, it'd be foolish to go through a big procedure to reverse vasectomies. And it is a big procedure if you're going to have a high success rate. Better just under local anesthesia, I can do a microsurgical sperm retrieval. We can freeze the sperm. So, even if you need a second IVF cycle, or even a third IVF cycle, the husband doesn't ever need to have any more surgery, and we'll do a mini IVF. And I think PCOS is a very good prognosis for IVF success rate because you've got to understand the reason for PCOS. You have too many eggs, and it sounds contradictory. It sounds like that's a good thing because PCOS patients are going to have a later menopause because they have so many eggs. But all these eggs, when you're younger, inhibit the pituitary gland secretion of FSH. And so you don't recruit a dominant follicle. And when you don't recruit a dominant follicle, then you either don't ovulate or you ovulate late and you have irregular cycles. But we know that women with PCOS have a huge number of eggs. So I think your prognosis with IVF and mini IVF will be extremely high. So I think we need to do sperm retrieval for your husband under local anesthesia, along with mini IVF for your PCOS. And we do that all together at once.